Alex Earl. Hello everybody. So Dr. Alex Earl here at Pure Plastic Surgery, and Hump Day is when I get to share plastic surgery topics with you and answer all of your yearning, burning questions. So today we have a very interesting topic, I believe, because it's something that we're seeing more and more of, that we're doing more of, and we're quickly becoming pretty much the #1 place to come for a BBL reversal. That's right, BBL reversal or BBL reduction. So those two terms are used interchangeably. So sometimes people say I want a BBL reduction, some people say I want a BBL reversal. But really the whole point is that they want to change something about their prior BBL. A lot of times, they want to go smaller, or they don't like the shape or anything like that, okay? And we're seeing more and more people kind of consult about this. We're quickly becoming the place to go for your BBL reversal right here at Pure. So first of all, why is this trend happening? Well, back a few years ago, I would say at least 5 years ago, maybe a little bit longer, the trends were different, right? At that point in time, it was all about having the widest hips, the biggest booty that you could get. Like a vixen look or video vixen look was kind of popular during that time. And also, any time before 2017, remember that BBLs were being done in a way where fat was being placed into or deep to the muscle, which we know is dangerous now, which led to many deaths, and we don't do that anymore, okay? But it also created these super dramatic looks with less rounds, with just one round, okay? And then what's happened over the years is that these dramatic looks have fallen a little bit out of favor, but more importantly, these looks, they typically do not go with the underlying frame of the patient. And so then the patients then are no longer happy with it. It's not a long-lasting look. It's not a long-term look in that sense, okay? And if there was too much volume in either the hips or the waist, a lot of time with time, remember that gravity always wins. And so if you have a very large buttock, and you have a lot of volume, a lot of weight to the area, gravity is eventually going to be kind of pulling everything down, and then things are just not going to look so good anymore. You're going to have what we call sometimes that diaper booty, which really you don't want to have. And that's why here at Pure, we've always kind of developed the South Beach butt lift. We developed that enhanced natural look. We've tailored our BBLs to the patient's unique underlying frame to make sure that they have a beautiful, long-lasting result, okay? So, needless to say, a lot of the patients that are coming back for that are not prior Pure patients. They're patients that have gone elsewhere, okay? So, let's start from the beginning. Why are people asking for this? Well, see, here are some of the most common reasons. One, of course, it's just too big. All right, I thought I wanted that when I was 20, or maybe when I was 25, and now that I'm 30, I don't want this big booty where people are kind of staring at me all the time, right? So that's one of them. The other one that's very common is you're too wide. And this is something that used to happen a lot too back then, where the hips were just made so wide, it really had nothing to do with the rest of the patient's body. You have these wide hips, sometimes you have your fairly thin thighs. It was totally incongruent. It didn't look like it belonged. You get like these ant booties or super wide booties, and it just, it's not basically a long-lasting shape. I don't think those patients that are too wide even liked it, back then, but they definitely don't like it now, and they want to get that reversed. Okay, but probably the most common reason that we have people coming back is because they want a different shape overall. So, like I said, once again, a few years ago, big lats were very common, as well as a shelf, creating that shelf between the lower back and the buttocks. So you would have these shelf booties with big lats, and that's really fallen out of favor here today. So right now, people even, when you have like the big lats, some people say that it makes the butt look squarish, or they have like a wisdom tooth type of look. That's definitely not the look that we're going for. And so a lot of people come back because they want a different shape. They want to reduce those lats. They want to turn their shelf more into a slope, and just to make sure that the lines are a lot smoother and once again a lot more fitting to their underlying frame. Okay, which is the last one here. They just want to be more proportional to their frame. So, what's the most common ask? One of the most common ones is turning that shelf booty into a more of a slope booty. Now, it doesn't have to be a complete slope. It can be like a pokey slope if you'd like. But you definitely don't want that hard shelf. That doesn't look good when the booty it comes straight down and then straight out. That just looks very, very fake, very, very surgical, and has fallen out of favor right now. The second most common ask is I want to decrease my lats. I don't want my lats to be more prominent than my hips. That makes the booty look square, gives you that wisdom tooth type of look. All right, so you definitely want to reduce those lats, pop out the hips, so that we can kind of change the shape of the booty from more of a square shaped booty to more of that signature Earl upside down heart type of booty. Okay, and so that's lastly the one here is like, Dr. Earl, I want to have more of your signature look. I want to have that kind of that Earl curve, that hourglass curve from the front, and that signature Earl upside down heart shape from the back. And so that's probably the third most common ask that we get for this procedure. Okay. Now it may seem a little counterintuitive, especially if you're coming just because you're too big or too wide. Why do we also need to do some fat transfer? And that's because in order for me to have the maximum ability to reshape things, I have to be able to both liposuction certain areas and add to certain areas. Now it's not going to be like we're doing like a full BBL. The whole point is not to add a lot more volume. In fact, overall, we may be having less volume than when we started. But I do need that ability to be able to transfer into certain areas so I can smooth out the contours and create more of that, that beautiful shape. Okay? So it does require typically, more liposuction and fat transfer to some degree. For example, say I want to go from that kind of wisdom shaped booty to with a shelf to a Earl upside down heart booty with more of a slope. Well, I definitely have to lipo those lats. So I got to do liposuction to the lats, bring the lats down, but then typically I have to add a little fat to the hips below that. Okay, so we bring it from a square shape to more of that upside down heart shape. Okay, and then if we want to go from the shelf to the slope, I actually have to add a little fat in this area here to create more of that smooth contour there. Okay, so that's why it usually requires both liposuction and fat transfer to be able to do these BBL reversal type procedures. Now, let's be clear. These are not easy cases, okay? These are not cases that you want to go to with someone who's never done one or doesn't have any experience. These can be pretty challenging cases, okay? That's one thing, and the other thing is that the expectations also have to be realistic, right? Typically I wasn't there, I wasn't the primary surgeon. Okay, of course things have already been touched. There's going to be scar tissue. There's going to be other issues. There may not be enough available fat. All these factors that play in that make it a challenging case, and therefore the expectations have to be realistic. Of course, the whole point is to make things look a lot better, to be able to change the shape, okay, but one can't expect, perfection, obviously, or like perfect symmetry or anything like that. No one's actually perfectly symmetrical side to side to begin with. So I always say, if God didn't make you perfectly symmetrical, then you can't expect your surgeon to, right? But we want to get things as close as possible, all right? So what are the contraindications? So, this is a type of procedure that has to be taken on a case-by-case basis, okay? Unfortunately, there may be some patients that have had surgery where I just unfortunately think I can't help them, and that's sad. I understand that, but if I don't feel that I can actually make things better, then of course it's not worth undergoing another surgery, another general anesthesia, or anything like that. So I do take these very, very, very much on a case-by-case basis. If I feel that I can help the patient and make things better, then I will take on the case. But if I somehow feel that it's just going to be way too tough, way too challenging, or potentially dangerous for the patient, then I won't take the case, okay? So that, as you all know, here at Pure Plastic Surgery, patient safety is our #1 priority. So I want to make sure that we're having a safe procedure, that we're going to have a decent outcome. And so that's why the evaluations for these cases are so important, okay? So what are some of the contraindications? Well, I might say, I don't think it's a good idea to go back. One, if there's too much scarring. If I can notice that there's just too much scarring, especially in that abdominal area because of prior lipo, maybe you had more than one lipo before, then it's just not worth going back in. Okay, that can create problems where the cannula may go to places you don't want it to go, where the skin may not do well, may not survive. You can suffer some skin necrosis or ischemia or issues like that. Okay, so if there's way too much scarring, that's a potential contraindication. The other thing that creates a lot of scarring is if you had lipo before that used some sort of energy device. What are these examples? Well, like laser lipo, right? Smart lipo, laser lipo. The other one is Vaser with a V, Vaser lipo, which uses ultrasound energy, okay? And then if you've had a lot of J plasma as well, all these energy devices, eventually can create, too much scarring and can make it very, very difficult to get back into these areas, okay? And the other thing that you need to know is that if you had your surgery perhaps several years ago or in another country or anything like that, but if you had the surgery and fat was placed into or deep to the muscle, we are not going to be able to remove that fat, okay? Right? That's the whole place, that's the place that's where I use the ultrasound, right? I'm trying to avoid placing any fat deep or into the muscle because the safe space is between that muscle and that skin. All right, so you definitely don't want to be in that space, and you can't liposuction that fat out. Once that fat is there, that's it. It's there with you for life. Okay, we cannot remove fat that's deep to the muscle or into the muscle. I can't liposuction muscle, and I don't want to get down where there's important vessels and important structures that can cause very serious problems. Okay, so that's one thing you have to keep in mind. So if your prior surgeon put fat into the muscle or deep to the muscle, that fat cannot be removed. We can only remove the fat that's above the muscle, okay? How can you tell? Well, sometimes if I have a question about it, I may have the patient come in for a preliminary consult, and then I can use my ultrasound here, the same one that I use in the operating room, to determine how much fat is above the muscle, right? So if you have very, very little fat above the muscle, then I always tell that patient that I can't really help them. I can't reduce that area because all the fat is into or deep to the muscle, and I can't touch that fat. However, if they have quite a bit of fat above the muscle, well, then that's definitely more promising. That means that that's the fat that I can address, and we can reduce the fat in that area that's between the skin and the muscle. Okay? All right. So that's pretty much it. I know we're going to have a lot of questions about this, but before we get into that, what's the best strategy? Well, don't get into this position in the first place, right? Especially nowadays. There's no reason why you should be getting fat into or deep to the muscle. All right, you should go to someone who has a lot of experience with this procedure, and preferably someone that's using the ultrasound so they can make sure exactly where they're placing that fat, okay, because it's a patient safety issue and you want to make sure that you're safe, okay, most of all. Second, you want to you want to have a shape that fits your underlying frame, right? That's what we like to call our enhanced natural shape. That's certainly part of our South Beach butt lift, which you can only get here at Pure, where we make sure that all those contours are smooth, that we have a smooth transition from the back into the waist, back out to the hips, and then down to the thighs to create a beautiful smooth contour there that goes in tune with your specific and unique foundation, okay? And then you don't want to go too big, right? Eventually that's going to be a problem down the line. We all get older, and like I said, at the end of the day, gravity always wins. So if you want a long-lasting result, you don't want to be coming back in a few years for back to Pure for a BBL reversal or reduction. Then you want to go to a place where they take all these things into consideration. You provide a beautiful enhanced natural result, which is going to be a long-lasting result. Okay. All right, so questions. Let's go for it.
Yeah. Is there an age limit to have a BBL reverse?
So yeah, I'm going to put the age limit as the same as my age limit for Lipo 360 and BBL. So for me, the max age is 50 years old. All right, after that, it just becomes a bit more complex. The patient typically doesn't tolerate the fluid shifts very well. And the potential for complications starts to go up. So I'm going to put the age limit at 50.
My wife got a BBL and her skin hurts. What can she do to feel better 3 months post-op?
Okay, so at 3 months post-op, I mean, you're still relatively early in the whole recovery process. And it's not unusual sometimes to have, odd like pains, pins and needles, sometimes burning sensations or stabbing sensations in the skin, especially in the areas where liposuction was done. So first of all, definitely continue massage, and I recommend just some self-massage on a daily basis. So typically what's happening is that you have these nerve endings that are hypersensitive at this time due to the trauma of the surgery. And so the way to desensitize these nerves is to actually massage them down every single day. I know it's a little bit counterintuitive because it can hurt, it can be very sensitive to touch, but that's actually what's going to help to desensitize the nerve. So you want to do massages for that. You should maybe get a professional massage or lymphatic massage once a week, self-massage on a daily basis. Sometimes it can be due to some inflammation, so you can take an anti-inflammatory such as ibuprofen. That may help. And if you've tried all of these modalities and you're still having some pain, another medication that helps really well with this type of neuropathic or nerve type pain is called gabapentin or Neurontin, and that's something that your surgeon can prescribe to see if that helps as well.
This one is in Spanish.
Okay, vamos para español.
Doctor, después de un tummy tuck, ¿cuánto tiempo tengo que esperar para hacerme otra lipo?
So, después del tummy tuck habría que esperar un mínimo de 3 a 4 meses para hacerte la lipo. Esa es una combinación que es muy común. A mí nunca me gusta hacer el tummy tuck y una lipo 360 o un BBL al mismo tiempo. Es mejor separar esas cirugías para mejor resultado a largo plazo. Y mi recomendación es siempre hacer el tummy tuck primero y después volver 3 o 4 meses después para hacer tu lipo 360 o BBL.
Is it normal to have high heart rate after a month BBL post-op?
So I would say it's not unusual. Okay, so sometimes you can have, a lot of times you're definitely going to have a higher heart rate in the initial post-op period. That's not unusual at all. I've had patients, or many patients, where their heart rate is like in 100 and the 1-teens after surgery. A lot of that has to do with fluid shifts and dehydration. Okay, so that's why we recommend that all our patients drink a gallon of fluid a day, mostly water, but also something with electrolytes like Gatorade, Powerade, or Pedialyte, and a little bit of pineapple juice always helps with inflammation as well. All right. Now, of course, with the procedure, say potentially you could become anemic, meaning that your hemo level drops. Okay, and it may not drop so severely that you need a blood transfusion, but it may take your body quite a while to build itself back up. So for those cases, we recommend that our patients go on iron supplementation, continue with vitamin C and folic acid. Okay, so help the body along. But while you're anemic, your heart rate may be a little bit higher. But after a while, certainly after a month, certainly after like 2 or 3 months, once your body's built back up and your hemo levels are back to baseline, your heart rate should then start to settle down once again.
Okay, the same question before, but now in English. How long after a tummy tuck can I have liposuction at the abdomen?
Yeah, of course. So, like we said, we said it in Spanish and here in English, just for everybody else. But whenever you do a tummy tuck, you want to wait about 3 to 4 months before then you go back for your liposuction procedure. This is actually a very common kind of combination that we do, a very common staged procedure that we do. I don't recommend doing it all at the same time, okay? But if you want the best long-term results for each, I typically, almost always actually recommend to do the tummy tuck first, and then get that skin nice and tight, and then come back at 3 to 4 months and do your lipo 360 or BBL procedure.
I had pulmonary embolism because of birth control. Can I still have surgery?
That's going to depend on the surgeon. So for me, any patient who's had a blood clot in the past for any reason is typically not a candidate. Okay, why? Because it's a totally elective surgery, and we just don't want to risk it. Now there are some surgeons out there that may take you on. Okay, and it's not completely unreasonable. I mean, the thought there is that it was provoked, right? Because you were on the oral contraceptives, and that's what caused the clot. and if you're off the oral contraceptives, then you should be back to baseline. And so a lot of times then what they also do is that they start you on a anticoagulant right after surgery to decrease that risk of blood clot even further. The most common one out there is called Luve, which is an injection that you take once a day, typically for about the first week after surgery.
I got buttock implants. Can be removed and replaced with fat?
So the short answer is yes, but it's also a procedure that I like to stage, meaning I think it's best to first go and remove the buttock implant, allow that capsule where that buttock implant was, allow all that to settle down and to heal down, and then come back, say about 3 months later, to do your BBL, okay? Why is that? Because if you try to do it all at the same time and the fat gets into that capsule, you're just gonna be feeling, it's almost like you're filling a water balloon with fat, and then that fat's never gonna survive. There's no blood supply in that capsule where you had your implant. So it's not gonna get blood supply, it's not gonna get nutrition, so there's no way for that fat to survive. It's basically just gonna die and become a scar ball of fat necrosis, or it can lead to infection or cysts or bigger problems, okay? So my recommendation is start with removing the implants, trying to remove a lot of the capsule, doing what we call collapsing the capsule, putting a few stitches to bring it down, allow all that to heal, okay, and then come back around, anywhere from 3 to 6 months later, and then do your fat transfer. And ideally, you would do that with ultrasound to make sure that you're putting the fat in that subcutaneous space between the muscle and the skin, and you're definitely not putting fat into some empty capsule.
I am a vascular ICU-RN. How soon after surgery can I begin working? In terms of full-blown CPR, I do a lot of full-blown CPR.
Oh, wow. So for anyone who hasn't done CPR, it is very strenuous. It takes a toll on your body. It's like vigorous exercise, if you put it that way, okay? So yes, CPR is definitely, it's tough. And if you're doing a lot of that, I would recommend that you wait at least 6 weeks, okay? So you want to wait 6 weeks, just like you want to wait 6 weeks to go back to the gym, to do any heavy lifting, any strenuous activity, or even to have sex. Reminder, guys, okay? You want to wait 6 weeks, and for a job like that, which is a tough job, a very physical job, I would wait 6 weeks as well.
Does your breast size decrease after a breast lift? No implants, thank you.
So the overall volume doesn't necessarily have to decrease, right? If you do a reduction, of course, that's the whole point. You add more tissue to what you're removing. But the technique for a breast lift and a breast reduction is very similar. But with the breast lift, what happens is that you're just removing excess skin and you're not removing a lot of the volume. So the overall volume doesn't have to change significantly. Having said that, your bra size may change, okay? Because if you have a droopy breast, the bra has to do a lot of work. It basically has to hold the entire breast up, and therefore you typically end up using a larger cup, say for example a D cup, okay? Now that you've had your breast lift, your breast is now, instead of kind of all the way down here, it's up where it's supposed to be, and the bra doesn't have to hold an entire breast anymore, because you have a lot of that volume in that upper pull where you actually want it. So the bra only has to do less work, okay? It has to hold up less breast tissue, and therefore you can a lot of times use a lower cup size. So if you have a breast lift, you can go from say a D cup to a C cup, but that doesn't mean that your breast got smaller. It's just now that you have a lot more tissue up in that upper pole of the breast where you actually want it.
Okay, Doug, this is a very interesting question. Can you target particular areas for BBL transfer, or do you do it evenly throughout and may leave fat in certain places because of the 4-liter limits?
Okay, so that's basically an area about technique, and really the answer to that question really depends. It's gonna be very, very patient specific, right? So certain patients are gonna have areas that are gonna need more filling than others. So you're not gonna go. You have to tailor that to every unique patient, okay? And so you have to target those areas that need more filling first, but at the same time, you're always creating a smooth contour, right? If you're doing it right, you want to create a smooth contour at all times, because you don't want to put a bunch of fat in one area and all of a sudden you ran out of fat, and then what are you going to do, right? That's just not that's not a smart thing to do. So you wanna focus on those areas. And you're going to be filling the areas that need the most fat, but you also want to be kind of filling around it to create a smooth contour. You have to be thinking of that at all times and thinking about how much fat you have left to make sure you have an equal distribution on both sides.
My butt has lost shape with, massive weight loss.
Oh, yeah.
Can a BBL fill the flat spots at the bottom of my butt?
So typically it can. Now, of course, in order to do that, we have to make sure you have enough fat for the procedure. And it's one of the things that we do see with some of our massive weight loss patients, that they've lost so much weight that they don't have a lot of available fat then for their BBL procedure, right? So that's definitely gonna, we want to evaluate you, look at your photos, look at your questionnaire, make sure that there's enough fat left that we can use. And then yes, if we do have enough fat, then we can transfer it to those targeted areas and give you more volume to those areas. And fill out basically the skin, which is now loose from all the weight loss.
Okay. Okay, the patient says Monjaro. When I said massive, it was Monjaro. It's like Ozempic. So it's a medication for weight.
Yes.
Oh, okay.
So, but this is
Sorry.
Weight loss from any cause, right? Where it could be diet and exercise. It could be from all these new medications now that we have that they actually work really well. Or for bariatric surgery, right? Such as a gastric sleeve or a gastric bypass. But it's great that you bring that up because Ozempic and similar medications, they're becoming more and more popular today. They actually do work, right? So patients are losing a lot of weight with these medications without having to undergo bariatric surgery. So it's a great tool to use for weight loss. And my prediction is that the amount of people getting bariatric surgery is going to go way down because of these medications. But then, of course, the same problems are going to arise. Weight loss is weight loss, so you're still going to want to do the thing. You're still going to have a lot of that excess skin. So you're still probably going to come back for a lot of the procedures that are common with our massive weight loss patients, such as tummy tuck, arm lift, breast lift, plus or minus implants, BBL, actual buttock lift, and thigh lift.
I am 9 weeks 9 weeks after a 360 BBL. How long till I can go for the mommy makeover?
So you're almost there. I'd say you want to wait typically 3 to 4 months, so at least 12 weeks, okay? But then after that, you should be okay to go ahead and come back for the second round, which will be the mommy makeover.
Okay, this is a short one. At what point do I need to worry about transitioning to a stage 2 faja?
Right, so that's a good question. So after lipo-316 BBL, we are going to place you in your stage 1 faja. That faja is not the super tight faja, okay? Yeah, we want it to be snug, but it's not meant to be like the one that's giving you a lot of compression, okay? Why is that? Because you've just had surgery, and with surgery, there's surgical trauma to the skin. We want to make sure that the skin is doing okay before we put you in that tight compression. If you put too much compression too soon, that can lead to fibrosis. It can lead to skin necrosis, which some people call lipo burns or faja burns. Okay, so you don't want to go in too much compression too soon. You want to be in that stage 1 faja for at least a week, at least 7 days. Okay. Some people may require a little bit longer, and that's fine. Everyone goes at their own pace. But somewhere after at least 7 days, that's when you can then go ahead and switch to your stage 2 faja if the skin is doing well.
Okay, well, many patients ask about prices and quotes and scheduling, so how they go onto our website, please.
So yeah, let's do that. Let's put that right here. So let's see.
The masterpiece.
All right, so the easiest and fastest way to get all those questions answered about next available, when to schedule, prices, quotes, all these things is to go to our website, okay? So you're gonna go to www.pureplasticsurgery.com, okay? So www.pureplasticsurgery.com. Once you get there, there's going to be a button, okay, that says virtual consult. All right, virtual consult or virtual consultation. It's going to be a little button there. You're going to click on that button, okay? That's going to take you to a questionnaire. Make sure you answer that questionnaire fully, okay? Even if you're not sure about the answer, even if you want to talk to someone afterwards, just make sure you kind of fully answer every single line on that questionnaire to your best ability. Don't worry if it's not exactly what you're looking for, exactly what you want. Don't worry about that. But just fill it all out, and then you're also going to send 3 photos, at least 3. You can send more. So for most procedures, you want to send like a front, a side, and a side. If you're doing lipo360 or BBL, you want to send a front, a side, and a back. So 4 photos there, okay? And so what happens is that then our coordinators will receive this and they will reach out to you, okay? And that's where you can get all your questions answered. They're gonna do anything related to scheduling as well. But they can also, this is not the only way to have a consult, but it's the best way to get started, right? If you want to do a video consult with me, or you want to come in person, when you talk to them, when they reach out to you, you let them know you want to schedule a video or in-person consult, and they'll do that for you as well, okay? So it's just the easiest way to get started, the easiest way to contact our people. But once they contact you, you can pretty much schedule anything else that you want, okay? And that's just the fastest, most efficient way to do this. All right? Okay, everybody. Well, I hope that was helpful. BBL reversal, surgery that's growing and growing. We're going to see more and more of these. You want to go with someone with a lot of experience in these cases because they are challenging. And we're quickly becoming a #1 place here in Florida, maybe perhaps the U.S. For these types of procedures. So make sure you send in that virtual consult so that we can do an evaluation. All right, everybody. Well, I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. Take care, everyone. Ciao.